The information and opinions expressed in this podcast do not necessarily reflect those of ASRM and its affiliates. These podcasts are provided as a source of general information and are not a substitute for consultation with a physician.
Welcome to ASRM Today, a podcast that takes a deeper dive into the current topics in reproductive medicine.
Hello, everyone. I'm Dr. Jeffrey Hayes, your host for this episode of ASRM Today. Today, I am speaking with Dr. Nicolas Plachta. Dr. Plachta is an associate professor at the Department of Cell and Developmental Biology in the Smilow Center for Translational Research, Perelmen School of Medicine at the University of Pennsylvania in Philadelphia. He is here today to talk about his experiences during the COVID-19 pandemic. Dr. Plachta, thank you so much for joining us.
Thank you, Jeff.
When did things begin to change in Philadelphia due to the COVID-19 pandemic?
It all happens around the same time everywhere, plus minus 1 month. I was in the middle of moving my laboratory from Singapore to UPenn this year. What's been very different is how the different governments handle it, how the different institutions handle the whole thing. But on a more personal basis, it's been very similar everywhere.
Is there anything that has surprised you professionally about how everything is going in reproductive care around this pandemic?
So I work more in basic research. We study very early development with animal models, with mouse embryos. So we don't see patients. So our research is very different from other people that basically there's nothing they can do because they just cannot see a patient, or they cannot, run experiments that involve more interactions with other human beings, etc. For us, it's been more, shut down the laboratory, put everything on hold everywhere on the planet. But we can still do, I've been surprised of, we can do a lot of work from home, because anytime you stop our work, we always have tons of data that we had to put together for the next paper. And so it's never a bad moment to pause for 2 months and write that paper that you've been delaying and so on.
As you were an associate professor of cell and developmental biology, is there a plan in place for the fall when you go back?
Yeah, absolutely. And that's been not surprising, but interesting to watch. You have the leadership, people that, are, deans of school or chairs of department and all these kind of people really reaching out, talking to the professors, making sure people, keep in touch.
Based on your professional opinion and your experience, what do you see as the future for reproductive care as we move on to this next phase of however life is going to be?
I think it's very unpredictable. One possibility is that not much happens. The other possibility is some governments, leadership, and so on realize that, yes, we really need to keep ensuring there is sufficient investment in research, in the NIH, etc. Also, scientific competition with other countries, China in particular, and the US. You could imagine new policies where the US decides, we want to do more leadership here. Just like the US did so much leadership in so many areas in the last 60, 70 years, in so many aspects. And now is the time where, are we going to go back to doing that? It's a little bit unclear, but should we do it in healthcare? Should we do it in reproductive care and these kind of things? Because that's an area where it was always so overwhelming that most of the things were done in the United States compared to the rest of the world, right? And now that has balanced a little bit.
Do you have any advice for other labs about when they reopen?
So I think the most important advice is mostly for those younger labs not to panic. Everyone's on standby, and it's better to wait. Don't rush it, because again, no one's moving these days anywhere. No one can do much.
I've had the pleasure of speaking with Dr. Nicolas Plachta today. Dr. Plachta, thank you for being able to join us. Thank you for taking time out to speak with us today.
Thanks, Jeff.
This concludes this episode of ASRM Today. For show notes, other information, and discussions, go to asrmtoday.org.